All right. So thank you everyone for joining us today. I am Camille Butterfield with Monolith Financial Group, and here today we have Mary Swartzik. She is our partner in everything Medicare. So she's going to be going over all the Medicare 101, and then we'll be answering a few questions towards the end if time permits. So, Mary, take it away. Introduce yourself to our attendees and get us going.
Yeah, definitely. So first off, thanks everyone for attending today. Camille and I have partnered together basically just to help all of her clients out with Medicare. I do hold my license in multiple different states. So I help out with the drug plans, the supplements, advantage plans, even dental, vision, hearing. So I kind of do a mixture of everything. Um, but today we're going to go over just Medicare basics. Also, we'll touch base about the AEP or the annual enrollment period as well, which is going to happen October 15th through December 7th. And Camille, can you see my screen okay?
I most certainly can.
Okay, perfect. So we'll kind of get into it. So on the agenda for today, we're going to start off with just the basics of original Medicare. So Part A and Part B, and then we'll talk about your Medicare options. So what I always tell people is you never just want to have Medicare by itself. So we'll go over the two options that you can pair it with, and then the AEP basics, the Inflation Reduction Act, which is something that's new this year in 2025. And it's going to affect everyone, not just people turning 65, but if you're already on Medicare, it's great that you're attending this because we will definitely want to touch base on that. And then just action items. So, what can we do after this presentation in order to make sure you're in a good position for 2025? All right, so we're going to start off with the foundation of Medicare. So I always tell people with Medicare, we kind of want to look at it like a house. So at the bottom of the house, we have our foundation, which is your original Medicare benefits. So you have Part A, your hospital insurance, and then you're going to have Part B, which is your doctor's insurance. And then on the sides of the house, you do have your optional products. So just going to make the house a little bit stronger. We have your Part D prescription drug coverage. And then on the other side, we'll have just additional products like dental, vision, hearing, hospital indemnity, cancer policies. And then at the very top, we have our roof, which is our Medicare options. So just like any roof, it's going to help with exposure coming into your house. When we talk about the Medicare options, it's going to help pick up your out-of-pocket expense that you would have with just Medicare by itself. So we'll go over Part C or Medicare Advantage plan, and then we'll go over the Medicare supplements or the Medigap policies. Another thing too is with Medigap and Medicare supplement, it's the same thing. They're just interchangeable words. So you'll kind of hear me go between the both of them, but same thing. All right, so we'll start off with Part A. I always tell people too, this is going to sound kind of bad. It's just Medicare by itself. Again, you're never just going to have it by itself. So it's going to have a lot of deductibles and co-pays. But I always think if you have a firm understanding of how Medicare works just by itself, when we talk about those two options, the Advantage plans and the supplements, it'll make a lot more sense because it's going to pick up a lot of this out-of-pocket exposure that you'll see in just a moment here. But we'll start off with Part A. Part A is your hospital insurance. So things that fall underneath Part A would be any inpatient hospital stays, skilled nursing, hospice, home health care. Now, typically Part A is free. That's what you paid into your taxes while you were working. So typically it's $0 for you. Now, if you were maybe staying at home, taking care of the kids, and your spouse was working, as long as they pay taxes for 10 years, you don't pay anything for Part A either. All right, so We'll go over what you would be exposed to with just Medicare by itself now. So let's say you go into the hospital and you're admitted as an inpatient. What you would be expected to pay right away is your Part A deductible, which is $1,632. And that says per period. Really important to remember that because that Part A deductible is not like a normal annual deductible just one time a year. It actually resets every 60 days if you didn't have a supplement. And then we have some more water coming into our boat. So let's say you're still in the hospital as an inpatient, days 61 through 90, you have a $408 daily copayment. Now, Medicare says technically they paid for the first 60 days. I say you did because you had to pay that deductible. And then if you're still in the hospital, days 91 through 150, you have an even higher copayment, $816 per day. And then for skilled nursing, Medicare will pay for the first 20 days. After that, you have a $204 daily copayment. Another really important thing to keep in mind here is you do have to be admitted into the hospital as an inpatient for at least 3 consecutive days in a row in order for Medicare to pay for those skilled nursing first 20 days. So as you can see here, this is all your out-of-pocket expense with just Part A. Moving on to Part B, which is your doctor's insurance. Things that are going to fall underneath Part B would be your outpatient services. So things you're normally going in and getting done, doctor visits, specialist visits, any durable medical equipment, so like diabetic supplies, insulin pumps, oxygen tanks, and then preventive services. Now with Part B, unlike Part A, there is a monthly premium. The average premium is about $174.70 a month, but it is capped at $594. We have a next slide coming up that'll talk about that because you could potentially pay a higher Part B premium depending on your income. Now with Part B, there is an annual deductible, so it doesn't reset or do anything crazy like Part A. It's only $240 for the year. Once you pay that $240, that's when Medicare kicks in. They're going to start paying 80% of your bill, and then you're stuck with that remaining 20%. I know the 20% might not sound too bad, but the problem with it is Medicare does not have a cap on it for the year. So what you're used to with your normal health insurance through maybe your employer, you might have a $5,000 medical max out of pocket. You know, worst case scenario, $5,000 is all that's coming out of your own pocket for your whole year for all your medical expenses. Medicare A and B does not have a cap. So again, that's why you never just want to have it by itself. And then on top of that, there is the Part B excess fee or excess charge. All that means is if you go to a doctor or hospital that does not accept Medicare's assignment for that procedure, they can bill you an additional 15% on top of whatever Medicare normally charges. All right, so as you can see, we have our boat, a lot of water coming into it. That's going to be all your out-of-pocket expense with just Medicare A and B by itself. It's a lot of holes, a lot of gaps. We'll talk about in a moment here, how can we plug those holes to make sure you're not experiencing all that out-of-pocket expense. All right, so kind of going back to that Part B premium, I have a chart here. It's going to break down the different income brackets and how you file your taxes. And that's going to show on the right side underneath Part B premium, how much you could be expected to pay. Now, it's interesting because with the government, they look back at what your modified adjusted gross income was 2 years previously to determine your Part B premium. So if you're signing up for Medicare in 2024, they're looking at that modified adjusted gross income in 2022. All right, so different charts, different numbers. And then on the very right side, you have that Part D premium. So not only can you pay an additional monthly premium for Part B, but that also could be applied for your prescription drug plan as well. I will say there's going to be certain forms that we can fill out for you if you do fall underneath one of these higher categories. One of them is the SSA-44 letter. I know Camille or I can help you out with that. It's going to have 8 different qualifications as to why you need that Part B premium lowered. All right. So now we're going to go over that roof. So those 2 options that we can have in addition to our original Medicare benefits. So the first option, what we're going to talk about is the Medicare supplement or those Medigap policies. We're going to go over the 2 most popular. We'll start off with the Plan G. The way the Plan G works is it's going to come in and it's going to essentially pick up all of Part A of Medicare. So that large deductible of $16.32 and those daily co-payments that reset every 60 days. If you're an inpatient, that's all going to be 100% covered. It's also going to come in and pick up that 20% for Part B of Medicare. It's going to pay for your first 3 pints of blood, hospice, skilled nursing. The only thing that the Plan G does not cover, you can kind of see it at the very bottom, is that Part B deductible of Medicare, which is just that $240 for the year. It's also going to come in, pick up that 15% excess fee underneath Part B. And you do have some foreign travel coverage too for any emergencies. So essentially, medical max out of pocket with the Plan G is $240 for the year. It's a very comprehensive plan. A lot of people like this plan if you travel because it will carry with you state to state as well. So no network restriction there. Now looking over at the Plan N, this is going to be the second most popular plan. It's very identical to the Plan G. It's going to cover all the same things, but there's 2 main differences. The first one is underneath Part B, the coinsurance or copayment. So it's still going to cover your 20% for Part B, just like the Plan G does. However, if you go to the emergency room, you will have a $50 copay, and any specialists, you have a $20 copay, where the Plan G will cover that. And then the last difference between the 2 is that 15% excess fee. The Plan G covers that, the Plan N does not. So you take on more of a risk sometimes with the Plan N, because if that doctor does charge that 15% excess fee or hospital, you could be stuck with that additional 15%, which can be pretty pricey if you're going in to have a pretty big surgery. Other than that, they pretty much are identical, no network restriction, go to any doctor or hospital you'd like, and you do have that foreign travel coverage with the Plan N. Now, if we're going to compare that to the second option, which is Part C, normally called a Medicare Advantage plan, the way that the Advantage plans work is everything is bundled together from a private insurance company, okay? So you're still required to pay your Part B premium to the government, that $174 a month, but now you're technically opting out of original Medicare and you're allowing that private insurance company to basically administer your Medicare benefits. So it'll come with network restrictions. It does include prescription drug coverage. The nice thing is with the Advantage plans, they can offer other benefits not provided by traditional Medicare. So you might get dental, vision, hearing, gym memberships. Sometimes those are included at no cost to you. And then on the very top right, you can kind of see the co-payment examples. These are just an average of what you could be expected to pay. with the Advantage plan. So it's more of a pay-as-you-go type plan. So as you can kind of see, doctor visits, specialists, labs, surgeries, hospital stays, chemo radiation, 20%. So a lot more copays with this plan. So the difference in coverage, if we're looking between the two options, you have to choose either a supplement or an Advantage plan. You can't have both. So option one, that supplement or Medigap policy, it will have a monthly premium. So you'll still have to pay that Part B premium of $174 a month. And then on top of that, you do also have to pay your monthly premium to have, for instance, that Plan G or Plan N. The plans remain the same with each carrier. So these plans can be a little bit easier to shop around for because a Plan G and a Plan N are standardized. Since they're regulated by the federal government, they all have to work the same way from carrier to carrier. The only difference is a monthly premium. There's no network. So as long as they accept original Medicare, your supplement's going to pay. It's guaranteed renewable. So as long as you make your payments every month for your premium, they cannot cancel your coverage. And underwriting is required except during your initial enrollment period or your special enrollment period. So initial enrollment period is your turn in 65. You have 6 months after your birthday to sign up for a supplement. And then special enrollment period, maybe you're working past 65 and had credible group coverage, ready to retire, get off that group plan. The government will actually give you 8 months after losing group coverage to sign up for a supplement. And then looking at option two, that Advantage plan, it's usually going to be a little bit cheaper on the front end because that insurance company is not going to charge you anything. Typically, it's a $0 monthly premium. Again, still have to pay the Part B premium though. It's state-based and county-based. It's going to benefits vary by plan. So these are sometimes harder to shop around for because one plan might have higher co-payments for hospital stays. One plan might have lower, but then they might not cover something as much. So it's good to definitely check into these plans if you're interested. We'll look at the summary of benefits, see if it's covering everything that you need to be covered. Network plans, so HMOs and PPOs, they're going to be a little bit more restrictive, approved annually by CMS. So if you have an Advantage plan now, that's great. Even if you're happy with it, we still want to chat during AEP because they change every year. So maybe a med that you take was covered in 2024, might not be covered in 2025. Same thing with doctors and hospitals with these plans. They can change and leave the network kind of anytime throughout the year. And then they don't ask any health questions. So if you have a supplement and you want to switch to an Advantage plan, they won't ask you any health questions. All right, so moving on to that annual enrollment period, AEP. Who is this time for? So it's a period of time for anyone on those Advantage plans, or if you have a prescription drug plan, or if you want to get onto one of these plans. What can you do? So you can switch from original Medicare to an Advantage plan or vice versa. You can switch from one Medicare Advantage plan to another, enroll in a Part D drug plan for the first time, or switch to a different Part D drug plan. And then when is it? It's October 15th through December 7th. If you end up switching plans during this time frame, your new plan will become effective January 1st of 2025. And then these are just some really good questions that need to be asked during AEP. So we'll start off with the top left, the Medicare Advantage and supplement. Is my premium rate changing on my Medicare supplement? So a lot of people don't know this, but you could be overpaying for your Plan G, right? And so this is a good time of the year that, hey, let's check around, see if you're being overcharged for your Plan G. And if so, let's see if we can get you a Plan G for a lot cheaper and the exact same coverage with a different carrier. Is your Advantage plan covering everything you need? Like I said, sometimes these plans change every year, so maybe something was covered one year, might not be covered the next year. Dental, vision, hearing. Do I have any dental, vision, hearing? If I do, should I increase the amount of coverage? We can always look at that too during this time frame. And then that prescription drug plan. So did my prescriptions change since last time I enrolled? Is my premium changing? And I know for a fact, especially this AEP, with all the changes that are happening, almost every drug plan is going to have premium increases. So if you haven't already got your annual notice of change, if you're already on a drug plan or Advantage plan, keep an eye out in the mail for that because you should be getting that soon, and it'll tell you what's changing with your plan. And then, have I been paying too much out of your own pocket for your prescriptions? Cancer, do you have a cancer policy? If you do, should we increase coverage? All right. So what we're going to talk about next is new to Medicare. It's going to start in 2025. It's called the Inflation Reduction Act. So with the Inflation Reduction Act, what's happening is typically with the drug plans, the drug plan max out of pocket is $8,000 right now. They're lowering it all the way down to $2,000. So that's awesome, especially if you've been paying a lot of money for your prescriptions. They should be more affordable this year. But that just means that an overall increase in prescription drug plan premiums. And then that will also affect formulary changes. So maybe a med was covered in 2024. Now that all these changes are happening, some drug plan carriers aren't going to be covering certain meds that they covered in 2024. And then last one is pretty cool. It's the smoothing provision. So what's going to happen here is if you're someone who takes a lot of meds and you have been paying a lot for them, you can actually spread out the cost of your meds throughout the entire year. So you're not paying, a whole bunch of money up front to pick up your meds. And then where can we go from here? So first one is just attending an educational presentation, giving permission to contact, and then bring in those annual notice of letter changes. So again, you should be getting that sometime in October if you haven't already. And then pick a better plan. So if you're not happy with the plan or a new one comes out that might be covering, your medications, doctors better, we can switch you to that. And then just overall enjoy your health care, right? So we paid for Medicare while we were working, so we deserve to make sure that we're happy with our plans. We know what's changing, and that's something that we can help you out with. And that's everything. So I just want to thank everyone for watching this, and I think we have some questions.
Yes.